Okay, hi, let's go ahead and start this question. You can go ahead and pause and try to answer it before I get into it, but I'm going to read it and then we're going to go through the answer. A 28-year-old man comes to the emergency department with a 4-day history of high fever, headache, and severe muscle pain. He recently returned from a fishing and hunting trip in Canada where he ate walrus, wild boar, and bear meat. His temperature is 103 Fahrenheit. Physical examination reveals periorbital edema and subconjunctival hemorrhages. Which diagnostic test is most appropriate to confirm the suspected diagnosis? And hopefully you came to the correct answer, which is muscle biopsy. A similar question to this can be found in offline NBME 24. If you're wondering about the diagnosis, we're going to go over that right now. This is Trichinella spiralis. And so the clues in the question include the fact that he came back from a trip from Canada. He ate bear meat. He has a pretty high fever, 103 Fahrenheit. And periorbital edema. The subconjunctival hemorrhages may not be mentioned in the vignette, but periorbital edema is pretty telling for Trichinella spiralis. So is bear meat. I added wild boar here because this is actually more common to be contracted through uncooked pork. And aside from Canada, you might also see a question talking about Alaska, people who go to Alaska and hunt polar bear, for example. In terms of the answer to the question, what is the most appropriate test to confirm the suspected diagnosis? The answer is muscle biopsy. And if you were wondering why not eosinophil count, that's understandable. Eosinophilia would be actually very high in a patient with Trichinella infection. However, that is not going to help us establish the diagnosis. That's considered an indirect test or indirect evidence of infection, whereas a muscle biopsy would be direct. The reason they do the muscle biopsy is to find the cystic form of Trichinella within the striated muscle. We don't do a blood smear because that wouldn't be helpful in this case. There's nothing in the blood that would indicate Trichinella specifically. There's nothing in the urine, so urinalysis wouldn't help us. MRI of the brain, Trichinella can cause encephalopathy. However, this patient, he only came 4 days after infection, presumably. It takes several weeks before things get that bad, and it also depends on the load of pathogen that this person has ingested. There's nothing in the vignette that talks about any encephalopathy symptoms. There's no meningitis symptoms, nothing that would warrant us getting an MRI besides headache. And a headache in the context of what looks like an infection, it's not enough of a justification to get an MRI. Again, we're looking for the best answer here. And even by NBME and USMLE, like test writers' own admission, many times a lot of the answer choices are correct. They're just not most correct. And so it's important to keep in mind that they like to say that the correct answer is on a spectrum, okay? So again, if you thought eosinophil, that's not unreasonable, but it's not the best answer in this particular case. So again, for Trichinella spiralis in particular, what are you supposed to look for in the question vignette in order to establish that this is Trichinella and then know that, you have to do a muscle biopsy, for example, if that's what they want to ask you about. Again, the consumption of undercooked pork is actually more common. It's a little bit more exotic and interesting when they mention bears. Okay, but they might mention wild boars as well. This is called game meat. Game meaning the type of animals that people go to hunt. So like bears, boars, deer. And again, Trichinella is associated with bear and undercooked pork. The periorbital edema is also, I don't want to say pathognomonic per se, but if they talk about periorbital edema, in the context of an infection, you can tell that this is an infection. He comes back and they mention something that he had eaten. You're going to be thinking about Trichinella spiralis. These particular cysts like to go behind the eyes. They also go into the tongue muscle, They go into the deltoid muscles and the pectoralis muscles. They like the upper chest for some reason. And they can also go to the heart. This is an image of the periorbital edema. You can see the edema around the eyes here. And the exudate here that looks like pus, it's not actually pus. This is an exudate that's coming out of the eyes due to the inflammatory process. This is because of degranulation of mast cells and eosinophils. This is, again, not pus per se, because pus is seen with bacterial infections, and this is not a bacterial infection. This is a helminthic infection. This is a worm infection, a nematode specifically. Also, they might mention splinter hemorrhages at that point. That's because the cysts have gotten to the heart muscle, and then you will see splinter hemorrhages as a sign that the heart is involved. This isn't the greatest picture, but I have to use what's free and public domain. But this is very obviously Trichinella spiralis. Spiralis meaning spiral, and you can see it makes a little spiral here. The cysts are making spirals. So Trichinella, trick itself, the word, is hair-like. So again, these are the larval cysts that are embedded in muscle tissue. Remember, Trichinella is a nematode, which is a roundworm, and do not confuse this with Trichomonas vaginalis, which is a protozoan, and Tinea solium, which is a cestode or a tapeworm. That one is also transmitted through ingestion of undercooked pork. The treatment for Trichinella spiralis is a bendazole drug. This is a bendazole, not azole. Azole is antifungal, bendazole is antihelminthic. Mebendazole or albendazole, and sometimes they add prednisone to sort of calm the inflammation down. Try to remember the mechanism of action of bendazoles because that is important for the exams as well. Bendazole drugs are microtubule inhibitors, and they prevent microtubule assembly. You'll recall that microtubules need to be assembled and disassembled in order to create the movement that they do. And so either preventing them to form will inhibit whatever process is going on, or inhibiting their ability to disassemble is another way to inhibit microtubules in whatever context we're using these drugs for. So just as a reminder, some of the other microtubule inhibitors include the ones that are anti-cancer. There are two types of anti-cancer microtubule inhibitors. There are ones that either inhibit the assembly or they inhibit disassembly. Inhibiting disassembly is also called hyperstabilization. So once the microtubule is made, it's not allowed to disassemble. And again, we need both assembly and disassembly for the microtubules to work. The taxanes, paclitaxel and docetaxel, are hyperstabilizers. And then on the left-hand side, you see here the drugs that inhibit microtubule assembly, the anti-cancer drugs vincristine and vinblastine, and then the anti-helminthic drugs, which is what we were talking about a minute ago. These are the bendazoles, albendazole and mebendazole, and then griseofulvin, which is an antifungal drug, and colchicine, which is used for acute gout. This table would be beneficial to memorize. Okay, that's it. I wish you luck, and I'll see you in the next one.